then we should have nice, like fairly good sex habits. Sleep with one partner at a time. We don't jump
sleep over
everybody
everywhere.
Yeah, and then and then if you're not sure of someone, use a condom, prevent those infections.
Do condoms do condoms bring infections also?
No, they do not bring infections, but they can irritate. Some people get irritation.
Just irritations, but not
Yes.
infections.
If allergic to them, some people get irritations. It can get bruised when they use the condoms. Yeah. So but and sex hygiene. Yeah. Washing up before, drinking plenty, emptying the bladder before sex. Normal sex practices. Because people do a lot of things, oral, fingers, what.
Those fingers also bring infections
if they are
because
not
they are not clean. Mostly they don't clean them.
Yeah.
So hand hygiene is also vital.
Very, very important.
Before cleaning the vagina, I should first wash my hands.
Yes. There's a
with soap.
There's a lot of things we can prevent by just washing hands. Every time you're from the toilet, wash your hands. Before you touch food, wash your hands. Even before you go to bed, wash your hands, because the phones are very dirty. The handbags are very dirty.
And mostly we wash the hands before going to bed, then we touch on the phone.
We have to learn how to, not be slaves to our phones and devices.
Yes.
Yeah. So just washing hands with soap and water is a very, very key intervention for preventing infections everywhere, not just vaginal infections.
Okay. Yes. So Dr. Charity, now we have a medical camp for Muslim women. Yeah. It's in August from 28th to 30th.
Am I welcome?
We now here we are asking you, please be there. Please be one of the volunteers.
I will come. I'll come. You have to give me a date early so I can book off my clinics. Then I'll come.
We are in partnership with TMR Hospital.
Yes.
Yeah.
So we'll come, and when we assess women, we want to examine and see. We want to take swabs so that the lab can assess and see.
They are all scared because I told them we are checking cervical cancer, breast cancer. With cervical cancer, everyone is scared. I don't know whether they will come back for the results.
They should come, and we can give them preliminary results.
You wanna make tasty food and serious. You wanna do that dancing still. Come down in one no ya night. Sika de buto one night. Nairo agro ya sika. Sika de buto one night. Can down in one no ya night. Sika de buto one night. Can down in one no ya night.
N'okusingawo tunda bulungi n'okusingawo ng'okozesa butto wa modern alimu ekiriisa ate nga taliimu masavu awamu n'engano etakwatira ku ngalo. Modern yennyabo bifune kati mu maduuka wonna mu ggwanga.
By the way, what is your name?
My name is Bosco.
Yeah.
Shivara.
Ngagobine enkoko. Aina katungulu, aina n'akambi.
Basenga wabayitote.
Bikini mama demo. Ela kadebe katu ne bakamba bikini mama demo. Yafunyiga dem come over. These are the cases that I usually want to attend to, but they don't usually come in my office.
Nayi kiroke.
Lwaki oli mungatemu?
Wemba ngenda okuduka bwenti okusinziira. Yempa gia n'ensinziira bwenti.
Putulu. Okwita putulu. Bwe mira fo. Gwo oliko yenna. Bamukujjako mufu.
oyaba awedde
okuddukako olinamu ne giya
twetaagamuko ku mani power ngezanga amagi
amavumbe bulaba gekalakasa bayingiremu wakati tekawo obuko ogubalagala baveewo kino kyenkoze nange neesiba baaba you do as you wish please
and branding at Print Creations. From custom gift sets to unique promotional items, creative signages and general printing, we've got everything you need to elevate your brand. Visit us at Chum Towers, Suite 70 on Kuruma Road, Lighthouse, Suites D14, D15 and F13. We offer a wide range of stationery supplies, awards and a vintage collection that stands out. Call us today at 0934 893 333 or WhatsApp 0702 683 317. Follow us on Facebook, Instagram and X at Print Creations. Print Creations, where quality, excellence and uniqueness meet.
Assalamu alaikum warahmatullahi wabarakatuh. My name is Jeanette Umar Kasule, a member from the Elite Little Hijabis. We are proud of our religion Islam and we believe in decency. I believe we can secure the next generation through the Little Hijabis. Registration is ongoing. Please, our dear parents, bring your children and sign them in for the Little Hijabis. Don't make them miss this one chance that they will have in their entire life. And training will start on 20.
Bannayuganda muwulire ekitabangawo! nuclear process ekutuusaako Irene Namatovu atuuse mu Kampala ku Serena Hotel nga 20 mu August mu show gy'atuumye Strong Woman live okuyingira emitwalo 10 yeebye emitwalo 15 ku gate ate badde emitwalo 10 ate mmeeza ya milioni 3 ticket zitundibwa ku Papa Sport ku John Color Solutions ne ku Serena Hotel wennyene Irene Namatovu yasinga mu kyabayita authentic Ugandan rhythms enkuba ya Afro Pop egatta engoma ya wano n'ekidongo ono ya Afrima Award winner best female artist mu East Africa choreography ya Irene Namatovu screen stage n'amataala 20 mu August Serena Hotel mwana watu n'abamuwerekeddeko fogo kalempiza bimami bijje be strong woman ebikoze sente z'ekikazi twagala byana byeskoba bimadulo
kiwoza sente ziwawereza ku simu zabaddemu ekicupuli ky'etaano wereza endala
biwagidwa Uniform Pepsi Geneva Logistics Afro Mobile ne Sanyuka TV.
Diggy 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 da 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 diggy da. Wanna ku dance floor, come take it. Diggy 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 da 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 diggy da. Big a biggie biggie boy, come pepeta. It's a girl Karakasita, Mama Sita at King Mama, and one of executive media on the RealTime show with the girl Mini. Don't touch the dial. Maximum to the world.
Shame manji alirinnya lyange tuliko TMR Golden Living Health Chat. Mu Health Chat leero engeri gye tulinayo kampu y'abakyala leero tulina Dr. Charity. Dr. Charity leero agenda kwogera ku recurring infections ze tubeera nazo naye simanyi oba ekigambo infections kyavaawa. Doctor, how are you?
I'm fine, thank you.
You're very fine? Yes, you know how much I love you. You always look innocent.
I'm very innocent.
Very humble and innocent.
Yeah.
Eh? So how are you, Doctor?
I'm fine, thank you.
So, Doctor, abakyala tubeera ne recurring infections nga teziwona. Like, first of all, njagala kubuuza, where did that word come from? Because when I was growing up, nali siwulira kigambo infections. Like, I was hearing malaria, typhoid, ebyo. But I don't even remember us getting itching down there. I don't remember well.
Ekigambo infections just at abasawo tuizo kikozesa nnyo
yes.
Naye nga bw'ofuna kale ngambe bacteria oba virus negenda mu mubiri wetalina okubeera nekulwaza oba olina infection. Kati infection esobola okubeera anywhere. Infection mu matu, infection mu bulago, infection mu liiso, n'olwala luyinza okufuna infection. But each part of the body tulina amannya getuwa those infections. Okay? Like for the eyes, tuyinza okugamba conjunctivitis. For the throat, tugamba pharyngitis. Naye ndowooza abasawo tufuusemu lazy.
How?
We just say infections.
Infections.
Natakugamba kale omwana alwadde ayina infections. Infection ki? I want to know, is it a middle ear infection? Is it a throat infection? Is it an intestinal infection? Infection ki omwana gyayina. That is why it's nice for doctors okukebera omuntu. They take a history. Ekiyita history. N'obuuza omwana yabadde ki, alwadde ki, abeera atya, akola atya. Then no kebera. You examine.
You don't just assume.
You don't just say, yingira. Kyekikuluma omutwe gunnuma omugongo buki olina infection. Genda mu. Yeah. Kati ekigambo infection tugikozeseza bubi. But it just means that there's a part of the body that is like waliwo bacteria or virus nga nyingi nga zikufudde kale mulwadde okujja ne signs and symptoms ezo ezikuleese mu ddwaliro. That is why tulina okukebera to qualify the infections. I just don't tell you.
So where did the itching of the vaginal itching
so now we are zeroing down on the vaginal infection.
Yes, because that's what disturbing
vagina
women. Because I don't remember us.
Okay, the vagina is now a body part. Now we are going to focus on the vagina.
Yes.
Me, I'm a doctor for
women.
Vagina,
that side.
yes. So So the vagina can get sick. And that's when we say that the vagina has an infection. So we call it a vaginal infection. But the vagina is part of the reproductive system. So it's just one part. There are other parts. There's the cervix, there's the uterus, what your tubes, the ovaries, the pelvis, yeah. Kati, any of those can be sick. But I'm talking about the vagina a lot because that's what will bring the what? The lady.
Yes.
By now what? Vaginal infection. Ate ennaku zino, I actually picked this topic because ndabanya abachala bajjanga, they say they have UTI. But urinary system is separate from the reproductive system. Zanjawulo okujjako nti ziri very close. They are neighbors. Kati ennyindo bw'erwala tujja kungamba nti omwo mulwadde because the nose is sick. So sometimes urinary system erwala and sometimes the vagina erwala. Sometimes erwala zombi at the same time. Sometimes because they are very close, ono alwala n'agabirako munne. And it's very important okubyawula because if you don't tosobodde kubyawula, you might not treat it properly. Yes. Okay. And that's the challenge we've been having. Kuba abachala, they just come out UTI.
Anti yabawulira.
Sometimes it's not even
mutugamba UTI or mnogamba candida. So what's the difference? Me having a UTI and then candida.
Okay, kati UTI comes from urinary tract infection. Urinary tract infection mu system ya urine. System ya urine etandikira eno mu kidneys. Ensigo. Waliyo ensigo. Filtering omusaayi ne ziforminga urine. Urine nakkirira n'agenda mu kawago, the bladder ne storinga. Kati bladder ekuuma urine bwejjula n'ofuna ka sense ngende nkole susu. Then susu n'ayita mu urethra n'efulumya wabweru. Now that system can be sick without the
whole
vagina
system
being sick. It can be an upper urinary tract infection. Ng'etandikidde eno ku ureters up to the kidneys, oba a lower urinary tract infection tandikira ku bladder endowoozayo. Yes. But urine infection, for the layman, is infection ya akawago ne the outlet ya akawago n'ensigo rarely. Yeah. So typically ejja kuleeta symptoms like ofuyisa kumukumu, omusulo gukubalagala, ofuka omusulo nga mutini, bw'ogenda mu toilet n'ofuka nga
kujja mutini naye ng'oguwulira gukuluma.
And then bw'ogenda n'okola susu oba wakafuluma tonafuluma bulungi owulira oyagala kuddayo. Tofuse gwonna. That is a typical urinary tract infection.
Is it worse?
Fever.
Can we say it's worse?
Worse in terms of
like it is now high or it needs attention?
Yes, of course it will. Ojja kuba uncomfortable. Otagwa obujjanjabi. Oluusi weba erinnye waggulu eno ereeta fever, vomiting, no very sick, ne pain. Mundira. Yes, that's typical urinary tract infections. Naye abakyala abasinga bafuna vaginal infections, which are different categories, ate zishowing in different ways. Kati mwe tufuna itching in the vagina, discharging ewunya bubi, nga color ekyuse, and then nga discharge eyinza okuba ebalagala, olususu, okulumizibwa, lower abdominal pain. Yeah, I've said itching. Yeah. So that vaginal infection can be different from urinary tract infection. Yes. But ekireeta vaginal infections by'ebyenjawulo bwe muli candida.
Candida yaleeta vaginal infection.
Candida is a type of vaginal infection. Kati oyinza okuba ne vaginal infection nga ya bacteria, muri trichomonas, there's a sexually transmitted infections, gonorrhea, chlamydia, syphilis, nezireta candida, nezireta human papilloma virus, kireta cancer, bwe bityo nezireta warts, sundo, yes.
Waliwo abakyala bafuna obusundu?
Yes, warts, obusundu. Azifuna.
Because of the infection?
Kati infection with human papilloma virus yesobola okuzaala ki?
Obusundu. Bubeera munda mu vagina oba wabweru?
Kungulu, nda, anywhere. That's why kikulu nnyo okukola ki? Okukebera.
But women fear to go for these checkups. They fear the results. They fear the outcomes.
Kati okutya outcome tekikutaasa. You'd rather know and treat. Nfunye nnyo abantu bangi nga bagamba, I'd rather not know. Like ne batya okukebeza kansa omwagana baana kuba tebaagala kumanya.
Anti atya okufa ng'alaba.
If you don't check, ojja kutuuka ekiseera ng'olwadde ng'olina okukebera, oteekwa okukola ki? Okukebera okufuna obujjanjabi. And yet bw'okebeza mangu, okijjanjaba mangu, ne kiwona mangu. Yes. Twali tufuna nnyo obuzibu nga bamaama bajja leeti, bajja baswala okwogera nti nina ekikulukuto. When you're an old woman.
Nefiya y'okukebera wansi, dokita. Abakazi batya nnyo okuba nga tazaala. When you're not giving birth, ne bagamba we are going for a check-up but you're going to open your legs.
It's hard, but
it's very hard.
Tugezaako kikola in a way that is very respectful, nga tekimutiisa nnyo, n'omukwata mpola, because it's very, very important to know. Kinga emmotoka yo oyagala kugenda ku lugendo, naye toyagala kumanya oba brakes bwe ziri oba nedda, toyagala kumanya oba amafuta gamala. It's not fair to you. You better go and check and correct and go properly on your journey.
So, doctor, what brings the recurring infections?
Well, just like any part of the body, once in a while, oyinza okulwala. Naye otandika okulwala nga every month, every week, the vagina is sick every month, then there is a problem. So, what brings infections? I'm going to talk about the risk factors. In healthcare, oyinza obutayogera nnyo nti cause, what causes, because those are like bacteria, viruses, the infestations. But what are the risk factors? Lwaki ono afuna, ono tafuna? Kuba ffenna tuli exposed, you know.
Yes.
So those are the risk factors I'm going to talk about. The first one, maybe the top on the list, is sexual activity.
Sexual activity.
It is a risk factor for vaginal infections. Because abaana bwe ndaba abaana abawala abato, batono nnyo abajja mu clinic nga balina infections. Naye ate ffe mu bakyala abakulu abali mu kwegatta, ekitundu ekingi abantu abajja nga balina vaginal infections, they are sexually what? Active. That means having sex is a risk. Sex is nice, but it's a dirty game.
Yes.
Etambuza bacteria from parts where imagine bacteria everywhere.
In the whole body?
Yes. Every part of the body almost. There are few parts of the body that don't have bacteria. Like the mouth has the nose, has the vagina, has the throat, has the anus, has. But there are different types, and bwezibeereeyo, it is okay. Naye bw'ozijjaeyo n'oziteeka walala where it's not supposed to be, then it can make you sick. Yes. So sex can transfer bacteria from the anal area into the vagina, from the skin of your partner into the vagina, and from another person to you. So sex is a high risk for vaginal infections, and different types. Yeah. So That is one. The other, now there are infections that are sexually transmitted. Ezija because they picked it from one person and brought it to another person. Syphilis, gonorrhea, chlamydia, LGV, those are purely sexually transmitted. If I find a lady with gonorrhea, I know for sure that she got it from someone else. Okay?
Sexually transmitted.
Yes. But then there are those infections that are not sexually transmitted.
Like?
But they can be sexually facilitated. Like Candida. Candida is not sexually transmitted, but it can be sexually facilitated. Like BV, bacterial vaginosis. Bacterial vaginosis is nga bacteria z'omu vagina eza bulijjo zikuze nnyo okusinga bwe zina okukola ki?
Waliwo we zikula.
Kati oyinza okulwala ng'olina vaginal infections just because bacteria ezibeeraawo bulijjo ze zikuze okusukka we zirina okukola ki? Okubeera.
We zikula ne zisukkawo zikulwaza?
Yes.
Zirina level kwe zirina okukoma?
Yes. That's what brings me to the other risk factor. Okukozesa nnyo antibiotics. Ofunye ssenyiga, kifuba, antibiotics. Owuliddeko ka pain wano, antibiotics.
Sometimes we even now treat ourselves. We know the antibiotics we are supposed to use.
Yes, because those antibiotics disorganize the vagina. Ne zireeta organisms ezibeera awo bulijjo okukula. Bwe zikula ennyo ne zikulwaza. Ekirala bino bye tukola abakyala. I'm going to steam the vagina.
Yes.
I'm going to put there what?
We're going to put there garlic. We put momia. Like we need to tighten.
Jiki, no, those things make
vinegar.
us sick. Yes, those things. The vagina takes care of itself.
So we are not supposed to steam.
No steaming, just you're spoiling.
We put cinnamon. We put lemon. Then we steam. We sit there for over 30 minutes. We are steaming.
Yeah, you're actually
like mostly after periods. Yeah, we do the steaming. So it's not advisable.
No. The vagina takes care of itself.
After even the periods.
Yes.
It can take care of itself.
You're not even supposed to put your
the
fingers there
to clean.
You're not. It takes care of itself. Yeah. So we can't be doing those things. You disorganize the pH, you disorganize the normal organisms that are supposed to be there. Then it gets you sick. Yeah. So other risk factors are some things we don't call on ourselves, like some people who are sick, like the people who have diabetes, sukari, some chronic illnesses. Zinafuya omubiri. Kati olaba mukyala nga alina diabetes. Ekigenda okusinga omutawaanya mu reproductive system is candida. Yeah, because the sugar but wansi kati biba bikula mangu ne bikola ki ne bitandika omumusiiwa and she gets itching and what. So her immunity is one of the risk factors for getting a vaginal infection. Yes. So those are the things that make your body weak, disorganize the vagina, and cause the organisms there to overgrow and then make you sick.
Okay, so doctor, with those recurring infections, sometimes we get discharge, but there is the milk discharge, but again there is that yellowish discharge. Then there is this discharge of
can be green.
Green? I've never seen that.
Can be green, can be brownish.
Brownish kati waliwo n'amata nga galinga gafudde nga byekutte bituli.
Amata amafu.
Yes, and it is nga kivaayo like when should I go to the hospital, on which discharge? And which discharge is okay for a woman not to worry?
Okay, so normally abakyala tulina normal discharge. And buli mukyala alina you have to study your body omanye discharge is normal for you, because there are what differences, slight differences in amount, and especially during the cycle. At the beginning, never different. In the middle, never different. At the end, never different. Abakyala abamu balina too much, abakyala abamu balina katono. Now, when you learn what is normal for you, awo ng'otandika okutegeera ekiri abnormal. Ate ekiri abnormal kisinziira ku organism oba akawuka ki. But nsobola okutunula discharge ne mmanya nti this is most likely this. Yes. For example, waliyo akawuka akaleeta discharge okuwunya ng'ebyennyanja.
Yes. Yeah, sometimes I hear some women smelling like fish. Is that also an infection?
Yes. Some will cause a discharge to like smell like rotten eggs. Some discharge will not smell, naye ejja kuba too much. Ng'owulira, when you're sitting down, owulira nga
something flowing.
Kikuvaamu. Some will cause that one which looks like spoiled milk. Or sometimes we call it cottage cheese. Kirabika cheese. Nga amazzi geeyawula, then the white part also yeeyawula, then ne kirabika nga cottage cheese or spoiled milk. Yes, kati kisinziira ku organism ki ekireese what?
The infection,
yes,
the discharge.
That infection, yes. Kati omukyala bw'olaba nga olina discharge eri different from what you normally have, that's enough to
go to
get
the hospital.
health care. Yes. If it's different in the smell, if it's different in the color. Normal discharge, for example, will not stain the panty. So just a plain water. Not afuna.
Yeah. So there is a normal discharge.
Yes. Kati normal
because
discharge.
Me, I thought every discharge
is abnormal.
Yes.
No. The vagina is wet. That's why nagambye vagina takes care of itself. Ena secretions ezijja nga ziri normal. Nga zinaazamu. Zivayo. Ate zaawukana to the cycle. Cycle etandika n'omusaayi. Omusaayi ne gukala. N'okalamuko awo. Ne wajja discharge nga nkwafu. Nenga eringa rice water. Negenda ng'esofteninga. Nefuuka nga mucus. Omucus anaanuka bw'atya afuuwa baluni ng'ali clear oba mulimu patches of white, and then ne bimala ate ne bikwata ne bifuuka nga era rice water towards periods nga zijja. That is normal. Kati zaawukana mu amount. Abakyala abamu, like I said, balina amazzi, balina the discharge nga mangi, abamu babeera ne katono. Yes. But anything that makes the vagina, that makes you aware of the vagina is abnormal. Vagina eringa part y'omubiri omulala gwonna. Eringa your eyes, your ears. Kati supenda otudde awo tomanyi nti olina amatu. Okimanyi?
Simanyi nina ki?
Amatu.
Why, doctor? You know I have.
Unless you think about it. And you say, I have ears, yes, I have ears. But if you don't think about it, you're not aware that you have ears. And that's how the vagina should be. But if you're aware, otudde awo, okola bibyo, n'owulira ebintu, n'owulira ng'osiiyiwa, n'owulira nga bikubalagala, n'olaba ng'olina okwambala panty liner, something is wrong. No, okay.
So, doctor, with pant liners, let me ask something, because every woman abeera ne pant liners mu toilet bag, and we put them on a daily. So how many times in a day I'm supposed to change my knickers? The knicker.
First of all, you're not supposed to use panty liners.
We are not supposed to use pant liners.
It's not a normal thing. It's not a normal thing for you to move around wearing panty liners every day. Most times, let me tell you, panty liner, there is a problem.
Why? No, sometimes we fear that maybe I won't be able to change the knicker during the day.
You don't have to change the knicker. If you leave home in the morning,
yes,
and shower and go to work, and if you use washroom properly and dry yourself
Clean yourself
properly,
well.
you do not need to wear panty liners. You do not need to change your knicker in the middle of the day.
What's the problem with panty liners, with changing them?
And changing them is not the problem.
But wearing them
For me,
is
it's
the problem.
wearing them. Why do you need a panty liner?
I want to keep myself clean.
No, it does not keep you clean. It keeps the vagina warmer, moist all the time, irritating the skin all the time. The vagina needs to breathe. It needs to breathe. We do not need those things. Naturally, the vagina takes care of itself. So if you need to wear a panty liner, ask yourself, what is the problem?
Why am I wearing the panty liner?
What is the problem? Do I have a discharge I don't want to wash? There's a problem. We need to get rid of that discharge. Is it too much? It makes me wet. It goes through my panties. There's a problem we need to fix. If you're wearing it because you anticipate periods are coming and you do not want to stain the panty, that's understandable. And you do that once a month, like 1 week in a month, not the whole month. You understand? Yes. So if you need to wear a liner the whole month, ask yourself, what is the problem? Am I safe? And many times I see ladies in my clinic who think they are okay. But when I check, I find there is a problem. No, but doctor, I thought it was okay. No, it's not okay. Yeah. So some ladies actually think they are okay when they are not.
Akapanty liner, doctor, ngotukubye wala. What about tampons? What they are called tampons?
Even tampons are okay for their purpose of periods. Yeah. Over periods, you don't need them. Just to zambala to, that time of the month, your hygiene, they are okay to use if you change them. Because if you keep them for so long, they can also cause a problem.
What about soap and scrubbing?
Absolutely not. For the skin,
people scrub the skin.
For the skin, you can wash because the skin between the thighs is normal skin. It collects dirt. It holds a core. You know a core?
Yes. Doctor is Oluganda lokati. Omanyine ko.
So a core is no vaco. You have to scrub. But inside the vagina, the soft part, you do not need to scrub. You do not need soap. You do not need those. I don't want to mention. But we
the
don't need
things.
extra things like washes. What? Of course, those washes make you feel good if you have a problem. If you're smelling, your skin is irritated, you want to wash with those things and feel like you. But you do not need those things every day for daily life. No, we don't need.
So if I feel any smell
is not normal.
I just need to go to the hospital. I don't need to put anything down there.
No, you don't need to put. Unless you're doing emergency, a pessary you had, but you don't need to. And also, if you have recurrent infections,
I treat them, but they don't go.
Sometimes I have seen ladies with resistance to antibiotics, resistance to drugs. You're either using the wrong drug or using a drug which akawuka kali tekacha wulira eddagala eryo.
Yes. Kukola culture.
Yes.
That's when you do culture.
Culture kati etuwa erinnya eryakawuka ako nti kawuka gundi kekali awo and n'eddagala ly'osobola okukozesa. Kati ayinza okukugamba nti eddagala lino na lino tebikyakola. Totawaana. Use these ones. Yeah. So sometimes recurrent infections akawuka kaba tekakyawulira ddagala lyemukozesa.
A pessary is good.
And then sometimes n'abaami tulina okukola ki?
Abo tebawulira doctor baveeko.
Tugezaako.
I see women suffering with those recurring infections. They tell a man to go to the hospital. Nagana, I don't have infections. Mostly they say even the toilets. Is
toilets,
it true?
Toilets nganye tezigira.
Tezita infections. Zino ze tutulako butuzi doctor.
Okujjako. toilets ziyinza okuleeta infections mu baana abato abawala abatamanyi kusitama abatamanyi abakkiriza that thing to splash back on them what abaana abato bayinza okufuna urinary tract infections nga bakozesa toyi enkyafu naye ffe mu bantu bakulu sisuubira nti omuntu omukulu asobola okutula ku toyi nakkiriza ebyo ebintu okumusaamukira
So sitting is not the problem, but what comes out.
Yes. If you allow
the
that
splashing,
to splash back on you,
it's only the splashing that can bring the ETI.
Yes, but if you sit on a toilet, on a clean toilet, or just a toilet that is not, you don't allow it to splash back on you, I don't expect jet infection.
So with sitting, you cannot be infected. Doctor, ngate ujja tubadde tugamba ekiro kya infections toy. Tuwayiriza.
Just tukkiriza ko
Mindset.
sometimes twaga arguinga nnyo n'omuntu musawo nakulimye wakale tula ku toyi ne
okuva we navudde ku toyi mpulira itching.
Most times biri ebirala risk factors ziri zetwogeddeko oba you treated, you're not treating it appropriately, oba eddagala you're not
tolimira bulungi.
Yes, and you need a culture, not?
Yes.
And the partner can also kati ekya partners ekyo you abaami bali very lucky. Anatomy yaabwe te multiplying tekuza bacteria. Yes, so
like they don't feel
you will not feel it. Ogenda kola tests mu lab, you will not get anything. Kuba nange ngenze ne bankebera nga tebalina kye balaba, which is okay. But I usually I equate it to like my hands. You know, my hands now look clean, but if I put them in the mouth of a baby asobola okulwala because I've touched my phone. This is dirty, but you're not seeing that. So that's how the penis is. It will pick up. You might have your bacterial vaginosis, and for some reason the bacteria has overgrown. But mommy najja and he picks that from you. Then you feel sick. Then we treat you. Then you get better. Then he will come back with his high dose, but not enough to make him sick. Then he will re-inoculate. Then it will, for you now, the body, you know how our bodies are. We receive, we multiply, we warm, we develop, make it bigger. Then you get sick again. That is why I need to clear it in the month sometimes, and also clear it in
the woman.
Yes.
So tulina Dr. Charity wano ku TMR Golden Living Specialized Clinics Enalia. Dr. Charity atusomesa ku recurring infections zetubeera nazo abakyala. So doctor, waliwo abaana abato abawala nga muto like 7 years 8 but ngafuna eyo discharge ey'amaanyi. You see even the discharge in the knickers. So omwana omuto yaba agijje watayina sexual intercourse zakola. So where does it come from? N'alyoka afuna ne discharge.
Abaana abato, like I said, for them they can get infections from the toilets.
From the
where
toilets.
they sit, yes. And they also have a risk of antibiotic use.
How?
Bafuna new antibiotics.
Like when they're still
cough
young.
and flu,
Yes.
what all the time, bafuna antibiotics. So it can also disorganize them, especially girls who are 10, 11, 12. So basobola ofuna candida infection. Yes. And then abaana abawala abamu tebamanyi kwesiimula. Basobola okwesiimula
n'ateeka mu ssusu.
nadda eno, yes. Kati bacteria ziva emanju ne zigenda
ne zo kipayinga wali.
Yes, kati bwe zidda mu maaso tezinabeera eno mu maaso, so zibalwaza. So that's why sometimes the young girls bafuna infection. Ate abaana bawala, the urethra is also very small. It's very short. Kati bacteria
urethra y'ey'omusulo.
Yes. Eyangu okwata kati ayangu ofuna UTI because of that anatomy, which is short. That's why abaana bawala tubayigiriza okwerongoosa nga badda emabega. Yeah, nga badda emabega. It's rare that tebajja kifuna nnyo buli lunaku. If you recognize it early and treat it, bajja kuba babeera bulungi tebakifuna nnyo zino zi recurrent infections ezibabeeramu. Yeah, but challenge tulina also is recognizing it kuba abaana abawala abaana abato teboogera.
Acidika.
Yes.
With that irritation.
Kati maid
yalabanika.
Maid tebafaayo nnyo omuzadde maama yalina okufaayo kebera abaana kebera nika okuwuliriza omwana oluusi omwana yeetakula then you don't see kati olina okuba keen ku baana abawala abato because they don't talk, they don't know how to report it so ne birwawo okukolaki okujjanjabibwa. That's the challenge I've seen with those little ones. And then omwana omuto afuna fever abeera ne afuna UTI zireeta fevers ennyingi kati mu clinic abantu abasinga baba bagamba infection nga tebanoonyereza ku eno wansi urinary tract infection oba vaginal infection. That's why abazadde balina okuba very keen for the young girls abatasobola ku reporting. But also the pediatricians these days balowooza nnyo ku UTI so bajjanjaba UTI.
So doctor, you've said we are not supposed to steam. We are not supposed to put a finger inside there. So how can we keep ourselves clean?
The vagina keeps
like
itself.
Me to make me feel that at least I'm okay, I'm clean and everything.
You must accept that the vagina keeps itself clean. And we can only clean the skin. There are like 3 different types of skin around the vagina area. So ey'omunda eri gye saagala tunaaze tulongoose, but the one of outside between the labia, yes, you wash, you clean with mild soap. Then the skin you shave, reduce the hair because the hair can hold that. And then our personal hygiene of choose a pad nga tulimu periods like frequently at least 3 times.
At least 3 times a day.
Okwambala empale nga ziri dry nga tuzoozeza bulungi ne tuzidryinga bulungi like once in a while dry the panties in the sun. Panties ezizoozesa nnyo detergent.
What?
And then you fail to rinse it because that can irritate the skin. Then we also select our sanitary wear properly. If something irritates you tokyesibaako nnyo, you try another one that will not irritate your skin. Twewale eddagala eritali prescribed, flu cough antibiotics. What antibiotics? Twewale okukola ebyo ebintu okuteekayo oba garlic bikoolakoola.
Garlic anti batugamba awonya infection.
Tubyewale. Then also
ne yogurt. Is yogurt okay?
Yogurt is good, but it supports like when you're itching mungi, irritation. Yogurt soothes the skin.
I can put it.
Yes, if you need it because it soothes the skin. But if your vagina is normal, you don't need to put yogurt there.
Yeah. But I can eat it.
Yes. Then we should have nice, like fairly good sex habits. Sleep with one partner at a time. We don't jump
sleep
everybody.
Everywhere.
Yeah, and then if you're not sure of someone, use a condom, prevent those infections.
Do condoms? Do condoms bring infections? Also,
no, they do not bring infections, but they can irritate. Some people get irritation.
Just irritations, but not infections.
If allergic to them, some people get irritations. They can get bruised when they use the condoms. Yeah. So but and sex hygiene. Yeah. Washing up before, drinking plenty, emptying the bladder before sex. Normal sex practices. Because people do a lot of things. Oral, fingers, what.
Those fingers also bring infections.
If they are
because they are not clean. Mostly they don't clean them.
Yeah.
So hand hygiene is also vital.
Very, very important.
Before cleaning the vagina, I should first wash my hands.
Yes.
With soap.
There's a lot of things we can prevent by just washing hands every time you're from the toilet. Wash your hands. Before you touch food, wash your hands. Even before you go to bed, wash your hands, because the phones are very dirty, the handbags are very dirty,
and mostly we wash the hands before going to bed, then we touch on the phone.
We have to learn how to not be slaves to our phones and devices.
Yes.
Yeah. So just washing hands with soap and water is a very, very key intervention for preventing infections everywhere, not just vaginal infections.
Okay.
Yes.
So Dr. Charity, now we have a medical camp for Muslim women.
Yeah.
It's in August, from 28th to 30th.
Am I welcome?
We now here we are asking you, please be there. Please be one of the volunteers.
I will come.
Oh.
I'll come. You have to give me a date early so I can book off my clinics. Then I'll come.
We are in partnership with TMR Hospital.
Yes.
Yeah.
So we'll come, and when we assess women, we want to examine and see. We want to take swabs so that the lab can assess and see.
They are all scared because I told them we are checking cervical cancer, breast cancer. With cervical cancer, everyone is scared. I don't know whether they'll come back for the results.
They should come, and we can give them preliminary results. I can see the service and say, oh, this looks good. Say, oh, this doesn't look so nice, but yes, we can treat. Yes, so it's very important to check. They should come ready to be examined, because I know a lot of ladies, especially our nice Baganda ladies, they'll say, musawo nabako. Kansoke nabeko. Come ready. Nze bwe mbeerawo nze nkebeera.
Yes.
Njagala kkebeera because reporting ebintu bingi. Musawo nze nina akazimba, nina katulututu, nina biki, nze ndi okay. Banjagala kkebeera ndabe. Is your okay the same as my okay? Choita katulututu. Is it the same katulututu for me?
But there are also those bumps of shaving.
Yes, kati nino byawula because abakyala ba reporting ebintu bingi.
Abamu batyo okwogera nga alina kazimba ng'ate agamba bump ya shaving.
Abamu boogera kirala, omu ayinza okutiisa, musawo nina ebizimba bijje wansi n'okeba n'osanga nti shaving.
So Doctor, you go back on your calendar and tick those days.
Which days is this?
28th, 29th and 30th of August.
28th, 29th and 30th. Okay.
So Dr. Charity agenda kubaawo mu examination. Doctor has confirmed. Yes. You know I'm also a gyno doctor.
By association.
Yes, by association.
I mean, we just learned
endometriosis.
Yes, we're not born knowing.
Now, even breast cancer, now I know how to check. I can tell people that lump, I should go to the hospital.
Yes.
Please check yourself like this. Doctor.
Yes, we have to learn. But buli omu aba alina knowledge. At least you can transmit. Kwanza so atukira buli muntu. If I have you as an advocate, gamba ekyo nno.
Genda mu ddwaliro.
Gende wa doctor.
Bakukebere, you can do a check-up.
It's very nice to reach, so that you can reach everybody, at least every woman. Yeah, so sinti buli omu asobola okujja n'ansanga, oba n'asanga abasawo bangi, but still wabeerayo omukyala okukyala eyo nga tamanyi oba alina okugenda mangu oba she can wait. Yeah, bwe tuba tubatuukiridde, it's nice for everybody.
Kale Doctor neyanziza.
Kale nya.
Wayiza Oluganda nno.
Oluganda ndumanyi.
Bulungi. Waluyigira wano.
Naye bulungi.
Naye ate gwe osinga eraddu.
Eraddu naawe yeraddu.
Osinga eraddu. Osinga ne Dr. Daniel.
Oh, thank you.
The pediatrician.
Daniel Lukwiya.
Ate ye talinaamu yadde. Ali bubi nnyo.
Nze asomera wano. Kyambogo college.
Basingira ddala. Kale Dr. Charity gwe tubadde nayo olwaleero mu health chat, tuli wano ku TMR Golden Living Specialized Clinics. Jangu bakole ne bambam BBL wano. Bakole ne tummy tuck. N'ennyindo. Ngenda kukola ennyindo. Yeah, I'm going to do nnyindo ndaalo So very soon I might be with that nose. Dr. Martin is a very good friend of mine. Yeah. Ate yakuddamu mukyazeeko Dr. Martin. Kale musiibe bulungi mweraba.
Executive Media. Focus. Innovate. Succeed.